It is crucial to understand the risks associated with engaging in unprotected sex, particularly when individuals are aware of their HIV/AIDS status. Additionally, the notion of getting back at a certain gender by intentionally spreading the virus poses a significant concern. This behavior, although not prevalent among all individuals with HIV/AIDS, has been reported in various contexts, highlighting the intersection of personal pain, prejudice, and public health. Let's explore the implications of these actions, the psychological and social factors behind them, and the broader consequences on both individual and community health. We will delve into recent statistics, discuss influential figures in the HIV/AIDS movement, and finally, reflect on future developments in awareness and education regarding such critical matters. The onset of the HIV epidemic in the 1980s transformed how society viewed sexual health. Initially, misinformation and stigma surrounded the disease, impacting those diagnosed. Individuals living with HIV/AIDS often faced prejudice, leading to feelings of isolation and anger. Some individuals with AIDS may choose to engage in unsafe sexual practices as a means of coping with their emotional turmoil. This self-destructive behavior can be seen as an attempt to exert control in a life that seems increasingly dictated by health concerns and societal judgment. Despite the potential for life-affirming treatment, including antiretroviral therapy, the psychological impact of living with HIV/AIDS often leads to feelings of hopelessness. Some individuals may feel betrayed by their bodies and seek revenge on those who represent the societal norms they cannot conform to, perpetuating the cycle of harm. The stigmas associated with HIV/AIDS have often forced individuals into a place where they might errantly consider the spread of the virus to others as a form of retribution, though this is not the norm. The impact of this behavior extends beyond the individuals involved. When someone engaged in unprotected sex while knowing their HIV status does not disclose their condition, it can lead to new infections. According to the Centers for Disease Control and Prevention (CDC), approximately 1.2 million people in the United States are living with HIV. While many adhere to treatment that makes them unable to transmit the virus, the threat of intentional transmission remains a significant public health concern. These actions can lead to increased healthcare costs, heightened anxiety within communities, and a resurgence of stigmas surrounding those diagnosed with HIV/AIDS. Influential figures in the HIV/AIDS advocacy community have worked tirelessly to combat the stigma and misinformation surrounding the disease. Individuals like Larry Kramer, an activist and playwright, and Elizabeth Taylor, a Hollywood actress who founded the Elizabeth Taylor AIDS Foundation, have profoundly impacted public awareness and legislation supporting research and treatment for HIV/AIDS. Their efforts have helped humanize those living with the virus and foster a sense of solidarity within affected communities. Unfortunately, there are still gaps in reporting and addressing these harmful behaviors. Much like other unreported crimes, cases of intentional transmission of HIV/AIDS can go unnoticed and unresolved. Victims may feel powerless and unsupported, leading to further trauma. The law surrounding these issues varies by jurisdiction, and not all areas recognize intentional transmission of the virus as a criminal act. This lack of unified legislation reveals the need for comprehensive legal frameworks to protect individuals affected by these actions and offer justice where it is due. Most individuals who test positive for HIV do not engage in harmful behaviors towards others. They often seek to manage their health responsibly. Moreover, individuals living openly with HIV/AIDS often become advocates who educate others about safer sexual practices, the importance of testing, and the realities of living with the virus. The understanding that HIV is a manageable health condition when treated appropriately is vital in discussing the implications of forced transmission and stigma. Additionally, education plays a crucial role in curbing this behavior. Comprehensive sex education that includes information about HIV transmission, prevention methods, and the importance of empathy and respect can help reduce stigma. Young people, in particular, should be taught about the responsibilities that come with sexual activity, especially when it involves individuals living with chronic health conditions. Community engagement initiatives that promote awareness, sympathy, and respect for individuals living with HIV can provide those in high-risk categories with much-needed support and resources. Recent years have emphasized the need to confront the socioeconomic factors that can exacerbate the issues surrounding HIV/AIDS. Disparities in healthcare access, education, and socioeconomic status can all play a role in increasing risk factors for both transmission and infection. Addressing these disparities is necessary to reduce the incidence of unintended transmission. Initiatives that focus on vulnerable populations, including men who have sex with men, people of color, and low-income individuals, are essential for improving public health outcomes. Looking to the future, several developments could help address the challenge posed by unprotected sex and intentional transmission of the virus. Continued advancements in biomedical research, including vaccines and pre-exposure prophylaxis, hold promise in preventing new infections. Increasing public awareness through campaigns and educational efforts can combat stigma and encourage disclosure between sexual partners. Moreover, the integration of mental health support into HIV treatment programs is crucial. Addressing the psychological aspects of living with HIV/AIDS could help reduce feelings of resentment and anger that may lead to harmful actions. Creating safe spaces for individuals living with HIV to express their feelings and fears can foster understanding and empathy within affected communities. In conclusion, engaging in unprotected sex while knowing one's HIV-positive status poses significant ethical and health implications. While some individuals may choose to harm others as a way of coping with their own pain, this behavior is neither the norm nor representative of the wider community of those living with HIV/AIDS. Continued advocacy and education are vital to improving public health outcomes and combating stigma. The work of influential figures and organizations in promoting awareness and education must continue to ensure the safety and health of all individuals. By fostering empathy, dismantling harmful prejudices, and improving access to healthcare, society can move towards a future where individuals living with HIV/AIDS can lead fulfilling lives without fear or societal backlash. 10 Down WJ, where creativity meets impact. 10 Down WJ, ENT,